the next component is the prevention support system. And in here, what we work to do is to develop support for those who will be implementing the innovation or the evidence-based curriculum. And there's two components. There's one that's innovation specific that relates specifically to the intervention. So in here is we involve information or to help communities decide whether this is a program that they want to use or not use. We work at looking at providing training for the implementation, and then later technical assistance once they're done with the training to help them evaluate, adapt it, and then also how to evaluate it again in relation to program and health outcomes. Another component of this is general capacity support. And this is focused on enhancing organizational capacities that aren't related directly to the intervention, but that are important components, things like staffing and how do I secure funding. So in this process, both CDC and in the effective interventions that's part of the DEBI program have provided a number of materials that help communities decide whether an evidence-based intervention is what they want to use, and specifically whether Cuídate is something that they need to do. I was surprised when I Googled Cuídate to see who was using it and what they were saying about it, was that there are a number of organizations that provide that support as well. I think I was most surprised by the National Episcopal AIDS Coalition that was there. But I'm wondering if you could click on the ARC button and we can go to the website. So this is part of the ARC Innovations Exchange. They have a number of different innovations, but mine is listed here, and we worked to develop this summary here in terms of what the intervention is. Here's a description of the science, a description of the innovation. You can keep going forward. Provides an overview of what the course is, what it focuses on, more articles related to the science if that's what's needed, my contact information. Importantly, did it work, and what's the evidence here? And what they did here, interestingly, was not just from a randomized controlled trial, but we did publish from one of our case studies outcomes, and so they also included some of their experience about what it does. So again, some targeted information about planning and developing, what are the key elements of the program, what are things that they need to do to get started, potential funding sources that supported this, and importantly, where to go to find more information about this. So again, this is a model that's used, that ARC has used not just for this innovation, but many, which I think are useful to communities. You can go back to the slides. So, so we have this information, and we're allowing communities to decide what evidence-based intervention to use. But in this particular mechanism, with CDC, you have a list of interventions that communities, if you want funding from your state and local planning committees, have to use these evidence-based interventions. And so, you know, while we talk about all these processes that are important, this is really what the reality. So it was more a matter of elimination as opposed to, yes, we know how to do this stuff, because in fact it represented a totally new way of doing things for us and for the agency we're working with, and it probably wasn't the best match. I don't want to be so crass as it was just a process of elimination, but in a way, we looked at all the things that CDC were going to fund and we said, okay, this is what we can't do, and we crossed those off right away. And then we had a dialogue in relation to our organizational capacity. So I think the fit at the beginning is an important component. So as part of this process, the process that I've been working with in the CDC is another component that they have. It's called the Diffusion of Effective Behavioral Interventions. And this was established in 2001 to be able to work on the dissemination of these EBIs into prevention practice and to provide a coordinated way to provide technical assistance both to states and community level programs. So my work in this dissemination process was really working with them on, yes, developing another curriculum, a trainer of trainers curriculum, and developing information and around commonly asked questions that we know communities asked around technical assistance. And then working with 3 branches of CDC that each had their separate implementation strategies and frameworks and theories and processes with different names, the Division of AIDS Prevention, Reproductive Health, and also now School Health. General capacity technical assistance, again, these are specific ones that were related to the intervention, or as I've been getting calls, is how do we recruit and retain adolescents? Where is it that we get funding? And probably the most interaction I've had with many communities is how do we convince our school boards that it's okay to bring condoms into the school? And how is it, and this is an email that I got from a high school student, is we want to bring this program here. How do we talk to our parents about getting them to let us come to such a program? So that was a fun conversation. So some opportunities and challenges in this dissemination component is that it's not, is working with the infrastructures around dissemination and scale up and sustainability. I mentioned working with the three components of CDC, which are extremely challenging. But as we were in the dissemination process, the Office of Adolescent Health put out $76 million for pregnancy prevention and developed similar infrastructures to, fund communities to work on evidence-based interventions. So they've developed a separate sort of dissemination and training capacity that I've had some involvement, but limited. And then we have published the curriculum to make it available to those who can't get the funding through the CDC. So all of these people being involved in dissemination has created a number of issues in relation to quality control, in terms of coordination of information, in terms of the feedback about training, about facilitators, and about adaptations. And importantly, there's a lack of communication for many of us who are involved in both these processes between the researchers and the trainers and what's going on. So we have no control over what's being disseminated in the field, which again is challenging. There's a lot of issues, or again, questions in the field about approaches to technical assistance and what are effective approaches. Do we focus on fidelity, or do we focus on program adaptation? And I will tell you, there's nothing so humbling as giving a training to a community group for them to tell you what's not going to work and why it's not going to work, and they don't care who you are, where you come from, how many RCTs you have, how many publications you have. It's just not going to happen here. So really working with them on adaptation is a point that needs to move forward. Another area of technical assistance is really building organizational cultures that support that type of intervention, working with communities to develop the evaluative capacity so that they can understand how this works within their communities, and then being able to balance the capacity building versus the program dissemination efforts. I think helping people to do the intervention is the easy part. Helping them sustain it is the critical part. So the prevention delivery system, which I'm not going to talk about, really then just focuses on those individual organizations and communities and what is needed in order to be able to help them carry out that innovation over the long term. What are the characteristics of the organization related to the innovation-specific capacity as well as general capacity? Some issues here are, again, the match of the research and theories that are that align with community interest, really understanding what the climate is, both the climate within the organization for evidence-based interventions as well as those that are policy-driven, and understanding how the funding mechanisms affects that, both for program-specific innovations as well as infrastructure for organizations. So moving forward, a couple of thoughts that I've and others had that I co-opted here is how is it that we move to promote evidence-based interventions in communities. So we have a technology push, which is, again, to really strengthen, again, the work that we're doing, to really look at developing practice-oriented research, and then really thinking about how is it that we involve and collaborate with communities from the development through the dissemination phase. There are many models that we can use. There certainly is the market pull. There is more of a call from government and funding agencies for communities to use evidence-based interventions, and we in turn have to take a look. The scientific community has to market the benefits of using these in communities as well. And I spoke quite a bit about the delivery capacity. Importantly, how is it that we bridge the gap? So maybe we need to be thinking about best practices as rather than just packaged innovations for for understanding things. We need to take a look at and emphasize the control that practitioners, patients, clients, communities, and populations have in terms of using and adapting these evidence-based interventions. And importantly, emphasize the local evaluation and self-monitoring. That has to be an important component. We need research on the tailoring process and also on the new technologies that can help sustain some of these over time. These are some potential areas for research that were identified in a specific program announcement that had to do with the relation of dissemination and implementation of DEBIs. And these were some that Jeremy identified as taking a look at methods both to define and evaluate the core elements of interventions. Those were my best guess. Do we know they work? In real life, we don't know. So let's figure out and see if we were, spot on. Understanding the organizational changes that are required to adapt an evidence-based intervention are important. What organizations are ready and what makes them ready to be able to go through this? And then how is it that we develop interventions to help support the organizational structure, climate, and culture to promote readiness through dissemination and adaptation? So here are a few others that are on the slides as well, too. How does financing of organizations affect intervention, adaptation, and sustainability? How is it that we look at the adaptation process at all levels of the organizations, from the individual to the community? And how do organizational shifts affect fidelity and sustainability over time? In my own thinking, what I'm thinking about and hoping for is some ideas for implementation research is how to develop cost-effective training using multi-user virtual environments. I'm looking at Dana because she's the MUV expert here. So we have a proposal that we're waiting for the money to trickle down from NIH to be able to do that. And because the structure set up by CDC is costly, and we've gotten some incredible support for them to help us move that forward. I'm really interested in the factors that affect fidelity and sustainability over time. I think some of those are organizational structures, but we need to be able to monitor this over time. As I mentioned, I'm interested in what type of TA approaches will lead to the fidelity and sustainability, and importantly, how does all that work we do really matter in terms of outcomes? Jeremy mentioned international work or global work. I've been very fortunate not only to work on the development of my intervention in Mexico, but also did a parallel process of all these dissemination efforts with my colleagues in Mexico. And it was clear to us, in order for us to diffuse the program nationally, where we needed to do was to start at the top. So we really need to start at developing those macro policy approaches to work on moving some of those areas forward. So those are my thoughts, and I'll look forward to the discussion. Thank you.